Similar to that, since we're talking about outcomes, I heard you say once when you were describing your company-owned outcomes is that you wanted to do two things. You wanted to create care that was wonderful and care that was financially viable. So if we think of wonderful as an outcome, what does wonderful healthcare look like to you, both as a business owner, as a mother, as a person? What is wonderful care? Because I've said healthcare misses the point because we never talk about delighting patients. We always talk about satisfying patients. That sort of seems like a half measure if you're satisfied. I don't want to satisfy you. If I care for you and I make you better, I want you to be ecstatic about it. So I sort of see the same thing when you say wonderful care, but I'm curious what you think of when you say wonderful care.
So I'm going to give you an example as a mother. I have 2 young daughters, teenagers, who are in braces. And recently we went to see our orthodontist. And this orthodontist has magical powers. And the reason is, for starters, is because she can get my teenage daughters to brush their teeth 3 or 4 times a day. That is talent. That is a coronary talent. But the interesting part was, so now they had to get their rubber bands changed out and the wires tightened, and these are small measures, small changes that they're adjusting for. So she was doing things that were physically painful, but she was explaining to them what she was up to and what she was trying to get done, and how it's a slow process. And while she was doing that, she showed them pictures of where they started 2 years ago, and then pictures at the 6-month mark and the 10-month mark, and showed them the entire journey. And then asked them where they thought, based on what they saw, that curve of progress looked like, where that could go. And so what she'd done is she had helped them imagine that journey, get invested in it, and say, what can I do to help to make this journey go well? And at the end of it, they were even curious about why this was not being 3D printed. And they had that conversation.
That's very interesting.
Right? To me, wonderful in this case is, first of all, world-class competency that she brought in service of their need, medical need. But in addition to that, she was able to engage them in their own journey, right? And get their buy-in to do everything that she needed in the form of adherence. And then the icing on the cake is she actually got them imagining what the possibilities for 3D printing are. I'm not saying that doesn't exist in orthodontistry. I'm just saying that these kids thought about it and had that conversation about what all parts in an orthodontist's toolkit could be 3D printed. That's special, don't you think? That's a very special orthodontist.
That is a very special orthodontist. That was Cobus that was calling me. I'm sorry about that. I agree. That's very special. What's interesting, I've asked some form of this question now twice. I don't have a large end to draw from. But both you and our first guest, Esther Dyson, chose dental examples. So, when I asked her, what was an example of an exceptional experience that she had, she talks about her dentist. And not just the dentist, but the hygienist who, is the person that she spends the most time with when she goes to the dentist and who takes an interest in oral health. And now, again, the orthodontist that you're offering, I guess time will have to tell whether this is significant or not, but I just remark that it's interesting that you both sort of had dental examples and not medical examples of, where you were delighted.
I've often thought that dentists were world-class at adherence. I mean, can you imagine they somehow managed to convince the world that you had to brush your teeth twice?
Right.
And traditionally, I read this book once, Charles Duhigg's Science of Habit. He talks about a stimulus, a routine, and a reward, that whole behavioral triangle of habit. And I was like, how did these guys get people to brush their teeth?
Right.
What is the stimulus other than dentist told me it's time for bed, I need to brush my teeth? I think this it's worth, I think the rest of medicine can borrow a lot of lessons. And dentistry is not even that pleasant, at least
Right.
from a patient perspective. I mean, you got your jaw open and your lips hurt and everything hurts, and you're just very, very uncomfortable, and yet you're very, very willing to adhere.
So shifting gears a little bit, you've been on the board of several health systems, is that right?
Not several health systems, only one,
Okay.
but several healthcare IT companies.
Okay. And from that vantage point, as you look at leadership within health systems, if you had an opportunity to sit down and have lunch with a large health system CEO, and they were curious what you thought about opportunities for improvement from a technology or an IT or a data perspective that they could turn around and take back and put action upon almost immediately, what suggestions might you have? Where would you suggest somebody like that start?
So, before we make suggestions to them, we have to first acknowledge that they have some of the hardest jobs we can imagine. They have a very tired and overwhelmed staff that works under the toughest conditions every day. They have anxious patients that they take care of. Almost nobody walks into a hospital for fun or just to hang out and say
Right.
hi.
I tell people it sucks to be a patient.
Right, and they have lots and lots of regulators that they have to answer to. They have tight budgets. So the first thing we have to remember when we approach this leader is they have a very tough job, and they're like masterful jugglers, right? In terms of what could they do, I think one of the biggest problems that they are faced with is staffing. A big part of their financial burdens is from payroll. And at the moment, it almost doesn't matter what you pay, it's very hard to find staff for many roles. Let's take the example, and these are not just clinical roles, but non-clinical roles as well. And this is not a discussion of whether that's a fair wage or not. That is not the discussion I'm here to have. This is about there's just not enough people with those specialized skills to meet all the needs of various job openings. So whether that's nurses on one end of the spectrum or medical coders on the other end of the spectrum, there's just not enough of them there with that level of skill, right? Given that my CEO, my guest at dinner, is faced with some of the hardest, is in one of the hardest labor markets, the conversation that I would engage in is, hey, how can we look at virtually every administrative process you have and systematically look at either foundational rules-based automation and or machine learning-based just replacement of people. Not because I want people to not have jobs, but because I have jobs that I don't have enough people to do. Right?
Which is true. I mean, that's exactly what we have found is that with Syllable, we're doing a lot of call center automation. And we've shifted our thinking and thinking that this is going to be a reduction in force technology. It's really a reduction in recruitment technology because the turnover in the call centers is extremely high. And if you can help health systems reduce the recruiting costs of trying to refill all of these people that are coming in, staying for a short period of time, and then moving on, it's a huge win for them. So I agree with you. That is definitely the way to approach it.
I would think you're in a third business, which is reduction in dropped calls, unanswered customer requests, right? And then it's reduction in recruitment, and it certainly is not reduction in workforce, right?
Right.
And so that's the discussion I would have with that CEO to say, let's take a look at this. And this is a step towards honoring your workforce as opposed to dishonoring them through automation, because then what you'll have left over, if you did this very, very rigorously, what you will have left over is meaningful work that humans were born to do. Because most of the non-meaningful work, you've automated it away, right? So burdensome, repetitive, non-inspiring, non-meaningful work, throw silicon at it.
So you see a future
opportunity to also get a little bit of relief on your financial statements.
So you believe that you can use a computer to not only augment the performance of a human being, but actually manage a certain tranche of the work that the human being otherwise would have to manage, that becomes mind-numbing and repetitive. And by allowing the computer to do it, the human being is sort of elevated in a way. Do you really believe that?
I do. So let me explain how I think about it. So when you take any function, right, there are parts of any function that are almost certain and clear as a bell, right? And so, which means from a machine learning perspective, the confidence in the prediction is so high that the machine can adjudicate the task. Then there is one layer above where the machine needs a little more experience and a little bit more training before it can adjudicate that task. And you keep rising up, rising up in machine competence. And over time, you're able to take most of the repetitive, non-creative, non-inspiring part and hand it to a machine, delegate it to a machine, such that then you have humans stepping in by exception or in review roles as opposed to heavy lifting roles. I think that is near and clear. That opportunity is near and clear. This is not science fiction.
I'm glad you said what you said, because one of the other issues that I've seen since I've been involved in this whole application of artificial intelligence as healthcare is not only the replacement of the human workforce bias, if you will, but there's also this bias that we keep running into, that every patient interaction with a health system needs to be a human-to-human interaction. Because healthcare is special, health issues are personal, brand is tied to empathy, and apparently empathy can only be achieved in some people's minds with one human being on one end of a telephone and another human being on the other end of the telephone. But you talk a lot about empathy and technology, and one of the questions that are consistently asked of us are, how will our patients interact with the computer? Or sometimes they'll just make the blanket statement, our patients will never interact with a computer. So with your expertise, what are the critical elements for a technology like AI that are necessary to promote an ecosystem where it actually becomes more empathic rather than less empathic?
So let's take a substantially less complicated piece of technology, a patient portal. If I was waiting for my lab results to know whether I had a severe issue, I think it's empathetic if you can deliver it to me real time by pressing a button, instead of making me drive 1.5 hours in traffic, then wait in line in your office, and then look for that, and then a staff who's already tired and probably annoyed at the end of the day, or probably partially hungry, find this envelope and then hand it to me. I actually think pushing a button and seeing it in real time is an act of empathy. So in that particular example, compressing time and offering me the convenience of not having to physically show up is empathy, right?
Time's a gift, right? So if I can give you the gift of time, then I'm respecting you.
And in many cities, not being in traffic is a gift too. You know what we used to say in LA? We don't say "I love you." It's "I will pick you up at LAX." That's what we say. So another example, when you think about empathy, I want to interact. Traditionally people have thought, well, there's something about interacting in person. A doctor and patient must be in front of each other. But if that patient was living in a rural location and could not access a specialist for their child, and if they could tap into one of the finest doctors with deep expertise in a given area, telemedicine makes that opportunity available. It doesn't fit into your completely into your question of interacting with a human to human, but it's done while jailbreaking from geographic constraints. So I think my point to you is, each one of the units of automation or units of opportunity, we look at it and we say, what is it jailbreaking from? What is the degree of freedom it's offering us? It's offering us a degree of freedom in time. It's offering us a degree of freedom in geography. right? It's offering us a degree of freedom in privacy. It's offering us a degree of freedom in certainty, right? It's offering us a degree of freedom in consistency. Whatever those are, I think the responsibility is on us, each one of us as innovators, to think carefully through what are we solving for? What is the degree of freedom that we want to offer through this innovation? And be able to articulate it and say, this is what we're solving for. Shall we do this together?
And I think that your comments about access are so intertwined with the whole notion of empathy. And when we first talked, you talked about how digitization has promoted equity. And I said to you, I don't understand. But it gets to this issue of access, and even telemedicine is part of your equation or your definition of how digitization is helping with equity. But rather than having me reflect back to you what I remember you telling me, can you talk a little bit about that?
So, digitization has done many things for us, right? For example, it's made information ubiquitously available. Medicine is very hard because it's one of those interactions where the information asymmetry between you, the patient, and your physician will always be very, very high. So, one of the things digitization does for you is it gets you access to information that you can read ahead of time or read after the fact to remind yourself of the broader context of what you're supposed to do. So that's one. That's an example. Another one is digitization gives you the opportunity to compress time. So traditionally, people with better access or better insurance or better whatever privileges could get in quicker, could get access to get certain forms of information quicker, and time is a big deal when you feel vulnerable. When you're down to your knees and feel vulnerable and anxious about a health situation, just compressing time between, desire and fulfillment is a very, very, very real unit of value, if you will, that you're conveying to whoever is in front of you. Digitization is underneath telemedicine as an option. It gives you an opportunity to go access people that, I don't live in California, but I can access someone at Stanford. That's worth something if you have if you need access to a very specific individual with deep expertise in something that you need help with, right? Digitization paves the way for transparency in payments, right? So then, if I think we're on this journey where we're improving explanation of benefits, we still have some meaningful ground to cover in terms of charge masters and how diabolical they are. We have ground to cover there, but I think digitization paves the path for financial transparency as well in healthcare. So, and all of this would have been irrelevant if the most disadvantaged members of society didn't have a smartphone. But we as a country have been more thoughtful than that, and a number of our welfare programs in various states do include communication. We've adopted this position, an enlightened position, that communication should be a free right, a fundamental right, and we should have public funds allocated to offer them a chance to be connected, right? And so, to the extent that access is available, that technological access is available, then digitization brings as much upside to that person as it does to me, and for that I'm very grateful.
We had Esther Dyson on the program last week, and she said that wealthy people pay for healthcare with money, but the poor pay with time and anguish, which I think is absolutely on point and supports what you just said extremely accurately. Because if you are or disadvantaged, every decision you make is a trade-off. It's a trade-off of, do I get my medicine or do I put food on the table? Do I go to my doctor's appointment or do I go to work? And more advantaged people are able to do both. And therefore, they benefit from this sense of time that, as you describe, really is sort of asymmetrically deployed across our own existence. So I think that's right. But at your heart, so this is interesting. I always am impressed with your optimism. So let me ask you this. Healthcare is an industry. And when you've worked with health systems, you've seen overburdened executives, you've seen overburdened providers, you've probably interacted with them. I've told you that when I was a hospitalist, I would get phone calls when the beds were empty, complaining about why the beds were empty. And then I'd get phone calls from senior executives when the beds were full that we weren't discharging patients fast enough. So it was never good. There was always some negativity associated with this. So from your vantage point, where do we begin, either as a society or as individuals, to change this negatively charged environment, to try to move forward with respect, as you describe, and empathy, so that we can begin to help our providers, who you rightly described as heroes, want to continue to do this?
Very complex problems almost never have one answer. So, we talked about one of healthcare's greatest opportunity being hyper-segmentation. And I think any change, whether that's perception-based changes or policy-based changes or payment-based changes, any of those has to be done in bite sizes and small groups of people at a time. I think there is I often think about, because I have high school age children, I often think about if there is an opportunity to educate them on interacting with the healthcare system, just like balancing your credit card and your bank statement is a skill. Taking ownership of your health and interacting with the health system is a skill, right? And taking ownership of your own health journey, and so and lay the foundation for here's all the things that have happened. That you were born in the right place is genetic lottery, right? But that you got all the vaccines and don't start with crippling disadvantages is an advancement of science and a privilege. And that was delivered to you by the boldness of our healthcare system and the boldness of our policymakers. Start over there and work our way up and say, and at different points in time, if some of the kids are athletes, they've touched the healthcare system sooner than some other kids, right? And talk about, you want to play soccer again? Who do you think helped you get back there in the field, right? When you progress to the age of, your childbearing years, your child is a miracle of not just nature, but also the extraordinary competence of medicine that has taken infant mortality to pretty close to zero, right? And at the other end of it, IVF, I think everybody can agree, is a miracle, right? It's pure magic at work, and we're still working on improving the yields and the yield rates in IVF and making those drugs more affordable. So I think what I'm trying to say is, at every interaction, there is an opportunity for healthcare to frame itself better, and explain how many of these, why they do what they do, and how many of these they do over and over again, and how they find joy in what they do. And putting language around that and sharing that with their patients, I think there's an opportunity to then improve their own brand, if you will, and and control their own messaging a little bit more. Because right now, the health systems serve you and then do nothing else other than send you an invoice, which you don't understand.
Which means nothing.
Which you don't understand for most part. And then the insurance company sends you an EOB, you don't understand that either. And I think there's a piece that's missing, which is, if you bought a luxury car, they gave you a BMW, right? And then they told you how awesome it was and how cool you are for driving in it, right?
Yeah, it's interesting. I would commonly remark to students and residents that when they got frustrated over a patient's complaining about being woken up in the middle of the night, or the lousy food, or the temperature being a problem, or the TV not working, and they would say, well, I just don't get it. This person came in septic, they coded 3 times, they were in the ICU for a week, they were intubated, they got dialysis, and we're discharging them. We saved their life. We rescued them from the throes of sepsis. And now they give us this scathing review. I don't understand. And I said, we're not being graded on the work that we did, because nobody comes into the hospital expecting to exit the hospital worse than when they came in. So all the work we do as doctors is essentially meaningless. It doesn't count to much. Whereas all the hoteling issues, the interpersonal issues, that's where the relationship, I think, has broken down a little bit. And we as providers have failed to recognize the importance that it's not just doing the craft, it's not or the profession, it's all the other things that go together that result in awesome care or delighted patients or, really wonderful
A
treatment.
watchmaker doesn't get credit for keeping time, right?
Right. Very
They
good
are
point.
expected
Yep,
to keep
absolutely.
time.
I love that.
But then they
Yep.
often delight people because now they have an opportunity to personalize straps. Then they are, if you look at my Apple Watch, then it can also it functions as an accelerometer, and it does so many other things
Right.
that I don't expect from my watch, right? It's a multifunctional device. So
Yeah.
keeping time is table stakes. If you didn't keep time, you wouldn't be in the watchmaking business.
Right. Exactly. Just a couple of last questions for you. So I'm curious from your perspective about as you have interacted with healthcare organizations as purchasers and with your technical bent, are there skill sets missing within health system C-suites these days that would be more beneficial for them in terms of evaluating technology or evaluating processes that we talked about to improve revenue cycle or claims or other processes within healthcare delivery?
So the first thing I'll say is, when you look at each industry, right, there are revenue bearing people and then there are support people, right? So the revenue bearing people are often the best paid and the most influential and what have you, right? Whereas the support people are there to support and magnify the effectiveness of revenue producers. If you work in a hospital and if you're an IT guy, you're not producing revenue. It's the physicians and the clinical workers that are producing RVUs, right?
Right.
And so your job is to help them make more RVUs, right? And so by definition, that's hard to hire the highest and best people when it's a support job, right? I think so. Instead of thinking about skill gaps, I think there is an opportunity for us to revisit the culture conversation and think about how we set up organizations where the functional experts in every role, the best of them can come together to dramatically change health. And some of the most progressive leaders in health systems in the country are doing that today, right? And they are able to attract world-class technical talent as much as they're and when I think about technology, it's not just the tech leaders that have to evaluate this and find a way to incorporate it. It is clinical leaders that also have to be technically trained or technically savvy and aware. It is operational leaders who have to understand and see the potential of transformative technology. So, being digitally aware and improving the digital IQ of an organization should be a priority for every leader in healthcare, in any other industry too, but for every C-suite leader in healthcare, digital IQ is a very important thing, as is the importance of an organizational culture where the best-in-class talent in every functional area has to come together. And I think between those two, if we can bring those two together, I think we're better positioned to leverage technology in healthcare IT, in healthcare delivery.
So I said that was going to be the last question, but that leads me to one other question. Are we expecting too much from hospitals? The whole concept of the general hospital, in my mind, is kind of suspect because no hospital can be good at every area. Not every hospital can do cardiac catheterization. Not every hospital can do transaortic valve replacement, but yet they all try to. And especially in geographies where you have competing health systems, you have 2 of everything or 3 of everything. And there's just not enough talent to go by, or to go around. So is there an alternative models that might apply as far as technical expertise is concerned, or do you think not?
I think there are a number of issues riddled within the topic that you're presenting, right? There are economic issues. There are profit maximization. And by that, I don't necessarily mean just profit, but personal goal maximization, growth maximization, organizational goal maximization issues in there. There are issues of where one organization has insufficient capacity. There might be a capacity issue. There is a reasonable perception that the incumbent organization is not good enough and I can do better. I could make an argument that a single point of failure is bad. So if a city had only one place that can put towers in, I could make an argument that that's bad, right? So I have a hard time taking one side on this. Where I think the opportunity is technologies like telemedicine, or where we have paths to scaling capacity and accessing capacity in different places, and to the extent we can do that over time, then the forces of supply demand will force people to right size, if that makes sense. Now, I do roll my eyes every once in a while when I see a crane and one more hole being dug and one more building going up, and I ask myself, this hospital needs 2 more buildings? Wow. Right. But I'm also careful to say I don't fully know. And maybe they have uncovered certain needs that this community has that's not being met, right? I think there is a more, I think instead of thinking about it just at the individual health system level and their choice level, I think there is an opportunity to take that 2 or 3 notches up and acknowledge that when is the last year we expanded the capacity for CMS-funded medical residents? I think the early 80s or something.
Yep.
I think that is I think we should back up and start at that level when we think about capacity, because at the end of the day, people are living longer. Number of diseases and our ability to address them is growing. And so then we should go back to and do more root cause analysis on it and rethink capacity sizing from an intake and funding perspective. And you work your way from there. I'm sure there's some optimizations at the health system choice level, but I think there's optimizations much earlier than that in the value chain.